So I wanted to talk about the psychiatric medications that I've tried over the course of my life and why they were prescribed and if they worked or not. So I'm going to go back and say what my actual diagnoses are. I'm diagnosed with dissociative identity disorder. I'm diagnosed with complex PTSD, unless you're using the DSM criteria, so then it would just be regular PTSD. I'm also diagnosed with, some people think I have bipolar 1, some people think I have depression. There is some evidence that I may have had a more traditional presentation of bipolar 1, but after getting repeatedly raped and stun gunned on the head, now I'm just sort of like always manic, basically. So I actually need to talk about that with my psychiatrist. She got my medical records recently. I'm seeing a new one. And I prepared her for it. I'm like, okay, we have to talk about some of the diagnoses I've had that I don't agree with. So one of my counselors diagnosed me with substance use disorder because I used marijuana to self-medicate. I have a medical marijuana card now. It is a medication. So I don't agree with that diagnosis. But back when I saw her, which was like almost 10 years ago now, it was not legal yet for personal use in Ohio. It was decriminalized. It really was not a big deal if you got caught with pot here. Most cops wouldn't even arrest you. They'd just make you throw it out or something like that. A lot of them were really chill about it, but technically you could have been fined like a parking ticket. Well, actually, you don't get fined for the pot. So what you would get fined for would be the paraphernalia you were smoking the pot out of, because that's a $150 fine. I've never had that happen to me before, but before I had my card, I was a little bit hard and got my medicine on the streets, yo. So, and God, I do not recommend you ever do that. Just go to a legal state and get legal marijuana. Do not buy off the street. They really do put shit in it. Usually really small amounts of shit. But God, I used to think that there was a withdrawal syndrome from getting off pot. There isn't. I've gone off and on medical pot for the last like 3 years now. And there's just a range of side effects I don't have anymore from pot. And I'm pretty sure it's because the street stuff I used to do was laced. So it's much better now. So I will talk about my use of medical marijuana as well, because I think that's really a really good thing. It's not perfect and it doesn't really fix problems, but it is a very good band-aid, so to speak. It does work. It does stem the flow of metaphorical blood. So those are my mood disorders. I may or may not have bipolar 1 that just turned into a constant mania. But I mean, I still sleep all the time with narcolepsy, so it's a really shitty mania. And a lot of my depression, I don't have traditional depression anymore. I did when I was younger, but as I've worked through a lot of my PTSD stuff, now it's just more like my life sucks and I'm sad about that, but I think I'm justified in feeling really sad and hopeless about that. And a lot of stuff was kind of burned into me by getting gang raped. I'm sorry, I need to put a trigger warning on this video. I was gang raped several times and they said really nasty things to me about how worthless I was, and it like almost brainwashed me into like on an emotional level. Like logically I know that's not true, but like on an emotional level now I like believe it. So that's not really depression. That's not chemical depression basically. But it still looks and manifests like depression. So yeah, and I've been diagnosed with every anxiety disorder, basically. I've never been formally diagnosed with generalized anxiety disorder, but I've been formally diagnosed with all of the other ones. They're all horrible. So I have been on medication a lot throughout my life. My original diagnoses as a child were oppositional defiant disorder, Asperger's syndrome, which my current doctors now, aside from one guy who I used to see as a kid for the Asperger's, doesn't think I have it. They just don't. I make good eye contact and I have a lot of facial expressions. Not that there's anything wrong with having Asperger's syndrome. It's just, I don't think that's my issue. I think I have like 50 other issues instead. I have ADHD, and then that's also an adult diagnosis. I have narcolepsy though, so I usually have that medicated by my sleep doctor instead because they also prescribe stimulants. By the way, there's a national Ritalin shortage, and that sucks, and I'm going to talk about that in this video, too. Reactive attachment disorder, and then severe depression and anxiety. So up until 2015, or maybe 2014. The years blur together. I had two different therapists that I saw, one after another. I saw the one for a couple years, then I saw the other one. I kind of had them overlap because I wasn't super... I just fucking hated that this one therapist diagnosed me with substance use disorder. I read the studies. I knew marijuana was a medicine, okay? And it was really not very illegal. It's decriminalized in Ohio, technically. So it's not even illegal. It was never really illegal. But anyway, so because of that fucking substance use thing that she wouldn't fucking stop harping on me about, I ended up going to see a second therapist behind her back, and they both diagnosed me with DID because they both saw the signs. So here's the thing, and I should talk about this in a separate video about diagnosis. I see trauma-centered therapists. Usually they don't have like specialized training in DID necessarily. The one got training after taking on my case. She did specifically for me, which I really appreciated. But they're trained to see trauma spectrum disorders and the way trauma manifests. And they were both familiar with DID. They just had never really, they'd had a couple other patients with it, to be honest with you, but you know, it wasn't something that they specialized in, but they were still aware of it. So trauma therapists, if you're going through the whole diagnosis thing right now and you think you may have DID, see a trauma therapist. A lot of them will recognize DID, and they will definitely recognize the severe trauma that comes along with it. So if you don't go to a general therapist, they will not be trained to see trauma or to even deal with trauma. Actually, I've had a lot of therapists turn me away because I start talking about my history, and they're like, okay, you need a different level of care. We recommend some other people, not us. I've had that happen before. So yeah, long story short, I was on medicine as a kid and as an adult. And at the end of the day, it didn't really do anything for me. So when I was a kid, I was on antipsychotics for my autistic aggression. I don't know what the fuck that diagnosis was. I have my medical records from when I was a kid, and it says that. I'm just like, what the fuck? So I was on like Haldol, which is a typical antipsychotic. That's the hard shit. I was on, I can't remember the others. There were a bunch of others. A lot of them were typical antipsychotics, which are pretty hard. There were a couple of atypicals in there as well. I was on Abilify at one time as a teenager as an adjunct for depression. It didn't do anything. Literally nothing. I was on Zoloft. I was on like 5 different antidepressants. They didn't do anything. I saw a guy who eventually lost his medical license because he was prescribing people doses of medications over like the limit, the accepted limit. And nothing happened as far as I'm aware, but he still lost his medical license because he was basically overprescribing medication to everybody. And he did that to me too, actually. It didn't work. The higher doses didn't work any better than the lower doses. But let's go to when I was an adult. So basically as a kid, I tried everything and it did nothing. Literally nothing. Like I didn't have side effects and I also didn't have any positive effects. So as an adult, I'll go class by class. So I've had some experience with Xanax and Valium. Those are both benzodiazepines. They can be used, I believe, to treat seizures as well. Maybe not. Maybe I'm misremembering that. But they're also used for anxiety. So I've had them prescribed for anxiety, and I've also had them prescribed for restless leg syndrome. Currently, I have a Xanax prescription prescribed for restless legs, and it works, actually. Believe it or not, now I don't bop my legs constantly if I take it. So, and it does actually help. So I get a weird antidepressant effect from the Xanax. Not from taking it, not from like when I'm actually on it. It's like in the day after I've just taken it, I have a better mood, I have less anxiety, and I feel better. It's really interesting. I never thought of a benzodiazepine because they're usually a short-acting type of drug, you know, kind of like Ritalin. You take it and you have effects for like 4 to 6 hours, and then that's supposed to be it. If anything, you might get a mild withdrawal. I'm, experiencing some weird antidepressant effects from them. Nothing really big. It's very mild, but I like it. So I've been prescribed Nuvigil, Provigil, Ritalin, and Adderall at different points in my life, including as a kid. So studies say that Adderall is slightly stronger than Ritalin, but I have not found that to be true anecdotally. So Adderall, I can take it and I'll fall asleep on it like 10 minutes later, an hour later after it's kicked in, I will just fucking fall asleep. And then when I wake up, I'm more energized than I would have been otherwise. Ritalin will actually keep me up. It works way better for me at like keeping me awake, which is weird. Adderall did not provoke as much anxiety, but it did provoke a lot of anxiety. Actually, it also partially triggered something that I hadn't really remembered yet. Hey, what's up? Welcome in, chatter. It's nice to see you. This is I usually stream video games, so this is kind of an unusual stream. I just wanted to kind of have a video log of my thoughts on all the fucking medications I've been on over the years and how useless or useful some of them were. So yeah, I've been on Adderall and Ritalin for ADHD. They do help a lot with focus. They make me have really hard time with social interaction though. I just don't get those natural connections that you get, like to keep talking in this direction or to bring up that topic. It just doesn't happen anymore, and I'm just super boring. Oh, I appreciate that. That's fine. You can ask questions or share your experiences if you'd like. So that was the stimulants. Ritalin was the best in terms for my narcolepsy at keeping me awake. Provigil and Nuvigil were terrible. I barely felt them. They barely kept me awake. They lasted for a long time though, so I would end up really awake at really weird times. So I would randomly become wide awake like 10 hours into the dose, and they last like Nuvigil lasts like 12 hours. Provigil is shorter acting. It's like 4 to 6 hours, so you have to take it twice in a day. I didn't care for them. They gave me like muscle cramps, and so the Nuvigil, I had a weird medical incident back last February while I was on it, and it's unclear what happened, but one of the only new things in my life was taking Nuvigil, and I started having contractions. So Nuvigil is kind of notorious because it has reproductive side effects. It can cause spontaneous abortions, and it also reduces the effectiveness of birth control in women. The weird thing is it also decreases the effectiveness of non-hormonal birth control, like the thing that they stick up there that looks kind of like a slingshot, IUD. Fuck, what is it called? I can't remember. I've never gotten one personally, but it has reproductive side effects, and I just had contractions like I had gone into labor for no fucking reason. I had to go to the hospital to make sure I wasn't dying. I think abortion should be legal. I think it's the woman's choice. Although, that said, I don't think I would get an abortion if I ever were to become pregnant. That's the thing. It's just, I've had contractions without actually being pregnant, and you have those during abortions. Like, I may as well just have the fucking kid. They're really bad even if there's no baby. Like, I'm about to die kind of bad. And to be honest with you, I feel like, if I get pregnant in spite of all the precautions I take against it, the baby kind of deserves to live. I wouldn't classify it as murder, to be honest with you, but I do understand that because I do believe in the sanctity of human life, and I do believe it's kind of incredible when a child takes form, and to think that you cut short this potential life, it does depress me. I still believe in pro-choice, but me personally, I would not get an abortion if I were pregnant. I would honor the fact that life had formed in my body, and I would carry it to term, personally. I do agree with that. There are definitely some people who shouldn't be parents, and they won't do the responsible thing, which would be to put their child up for adoption. There are also some parents that will do things like drugs and stuff while they're pregnant, which can ruin the baby's life permanently. It could cause FAS or any number of health conditions, and they don't get to lead the life they deserve to live. Oh, yeah, and the foster care system has tons and tons of problems with it. There are a lot of people who get into it for the wrong reasons. A lot of, I don't know that I'd say a lot of. I wish there were some studies on this, but I'm pretty sure some foster parents get involved in it specifically because they're pedophiles and it gives them easy access to children. I just suspect that that's a thing based on how many reports you see of that. It's like, well, those people had to know they were into kids when they went into this adoption, so I kind of suspect that was the reason why they did it. But, yeah, so I basically had a spontaneous abortion without being pregnant on New Vigil. So I'm like, you know what? I'm done on New Vigil. This is never happening again. So those were the stimulant medications. Studies say Adderall's supposed to be the most effective, but I did not find that to be the case. Studies do say that that New Vigil and Provigil work less effectively than the traditional stimulants of Ritalin and Adderall, and I did find that to be the case. They were definitely way less effective. I didn't care for them. Ritalin and Adderall both give me muscle tension that ends up kind of hurting. That's really just anxiety. They both amp up my anxiety. Gotta live with that, though, if I want to be functional. The narcolepsy's super bad. If I don't take stimulants, I can sleep 14 to 16 hours a day. And then when I'm awake, I'm really not even really that awake. I'm still super fucking tired, and it's a struggle. Oh, yeah, I do. So I guess I'll talk about medical marijuana again, since one of my chatters brought it up. I do have a medical marijuana prescription. I do find that it helps a lot. It helps calm down anxiety. It helps reduce the severity of flashbacks. It does help with my mood. So it basically makes my mood much more stable. And it also helps with my ADHD. I find that it slows down my thinking, so I'm not thinking like 20 different things at once, and I can tackle things like problem by problem. The only thing I hate about it is that a tolerance develops to it pretty quickly. So I always have to take breaks, like week-long break maybe at the end of the month, or else it loses its effectiveness. That's awesome. I'm happy to hear that. You know, that's the incredible thing about marijuana is it has so many potential medical uses. I also have chronic nausea and chronic pain, and it does help with both of those things. Let's see, what else? So I've been on some atypical antidepressants, and now this one's the wild one. I was prescribed Wellbutrin for about 2 months. It made me really irritable. It did kind of energize me like a stimulant, just a little bit, and I found helpful. It didn't help with my mood, really. But I started getting this odd perception. It was like for 5 seconds, I would forget where I was, and I'd have these vertigo attacks. So I didn't think much of it. They increased the dosage, though, and they got worse. Like, I'd have bunches of them for like 10-minute stretches of time. Oh, hey, Moon of Mordor, welcome in. Thanks for the raid. I appreciate that. Oh, why did I take the Wellbutrin? Very good question. I took it for depression. That's what it was for. So here's the thing. If you look up the studies on side effects of Wellbutrin, it has this warning that it can cause seizures. Now, if you look into the studies about it, it's a very rare side effect. Out of 1,000 people that take Wellbutrin, oh, awesome! Somebody subscribed. Thank you so much. I appreciate that. Or rated. I'm not sure. My overlay broke. I need to redo it. Because it tells me which one it was, but now I'm just getting the side effect. Or, not the side effect, the sound effect. I need to... This is a new overlay. I haven't finished it yet. But, yeah, so 4 in 1,000 people that take Wellbutrin will experience a seizure on it. Oh, you raided me. That's what it was. It took a second to load because I saw that you had the raid like a minute before it went off. Oh, everything's doing much better. I need to reply to your messages. You're always so thoughtful, and I always really appreciate it. But every time I look at Twitter, I'm just like, social interaction, will do later. And then I feel so bad because I missed so many messages. But, yeah, so I had a seizure. I went to Walmart, and I kept having these weird vertigo attacks where I would keep forgetting where I was for like 5 seconds. So I sat down, I was with my family, we were about to drive home. I'd gotten, I think, my prescriptions or something from Walmart. I went down. So I had no perception of the seizure. I had a grand mal seizure. It started with me, like, I suddenly, like, stopped mid-sentence. I was talking to my sister, and I just stopped with this, like, weird pose like this. And my sister thought I was making a joke and was like, but then eventually was like, she had to tell me what happened later because I didn't remember it. She thought I was making a joke, but then I wouldn't move. And then she started getting worried. She's like, Kristen. And then I fell to the floor and had a grand mal seizure, like a traditional seizure. So this is what's called a partial generalized seizure. The part where I froze is not a grand mal seizure. It's a partial seizure. But then it changed into a grand mal seizure, a generalized seizure, when I fell to the floor and my whole body started seizing up. So she said it was about 10 minutes. Somebody called an ambulance and I woke up. Oh, it was horrible. You know how you feel like when you get into a car accident or whatever, like you have whiplash? It was like that. My whole body, like I had pulled muscles all over my body. It was horrible. I was in horrible pain. But the weird thing was, during the seizure, after the seizure, I felt great. Like, you know how I was depressed? I was not depressed. I felt on top of the world. So the EMTs get there and start asking me questions, and they're like, "What's your name?" I'm just like, "I don't know." And they're just like, "What year is it?" I'm like, "I get that I'm supposed to know that, but I'm not sure." And everything was so funny to me. I was laughing. I was talking. Like, I was super excited to see these paramedics. And they were like, "Yeah, you had a seizure. We have to take you to the hospital now." Because, like, I had complete amnesia for everything except a couple of things. I can't remember what they were. I think I had forgotten where I lived. And I had forgotten how old I was and what year it was. They asked me who the president was. I'm like, I don't know. Am I supposed to know? But anyway, I recovered, like, it didn't take that long. It's maybe like 10 minutes, half an hour. And then everything came back to me. I'm like, holy shit, I had no idea who I was or where I was for a second. They did a brain scan. Yeah, it was a seizure. So I had to go get worked up by a neurologist for about 6 months after that. They gave me an anti-seizure drug. I had to get an EEG, which was normal. So they eventually wrote it down as side effect from Wellbutrin, but they had to assess me to see if I had like mild epilepsy that had suddenly been brought out by the Wellbutrin. I have not had a seizure since then. Wow, you had a friend lose 7 years of memory on Thanksgiving. Damn. Was there any medical cause, or was it just a purely dissociative fugue? Because I've heard of that. I had a friend, well, they were more of an acquaintance in college, and one day he just snapped, forgot who he was, went to like another city and started living there, and it was wild. So Wellbutrin did not go well for me. I was the 4 in 1,000 that gets a seizure on Wellbutrin. Had I been driving, and I might have been 10 minutes later, maybe not, my parents hate it when I drive, but sometimes I do, I could have died. So that was frightening. Never experienced anything like that since then. So no more Wellbutrin. I was on a bunch of different antidepressants. So here's what antidepressants do to me. I don't really like them, to be honest with you. So ever since a lot of bad things have happened to me throughout my life. That includes, I don't know if trafficking is the word, like if it's a pedophile ring, but they're not really paying money for anything. And I think they might have been paying money, but I don't know. Is it just gang rape a bunch of times, or does that still count as trafficking, especially if they filmed it, because they filmed it. So I have no idea. But it was some kind of trafficking, like gang rape situation that went on for years and years as a kid. So as a kid, I had partially repressed it. I remembered some of it, like, all the time. Because, it felt like I just lived it. Other times I got knocked out, but then woke up in the middle of it, like it was real. Oh, damn. She lives in a wheelchair and goes to the hospital, I think, weekly. Damn, that poor woman. That's rough. I'm sorry to hear about that. But yeah, and then other things I completely repressed. So as a kid, I either did know or I repressed it. So weirdly, as a kid, antidepressants did not make me suddenly remember things. But as an adult, and then I got re-victimized as an adult, I think by the same people and some new people, it's hard to remember. A couple of them were new people, but that were unrelated to that. But when I moved back here to my hometown, it was, I think, the same people and some new friends that did it with them. But so I got re-victimized, and they knocked me out during the assaults, which is why I sound really stupid whenever I talk about them. I have a hard time remembering them, and sometimes I can remember them super vividly. Other times I forget and I remember a different part. But so the antidepressants are now triggering me to remember the stuff I was knocked out for, which is interesting because antidepressants are known for causing drug flashbacks. There are some studies that show that. I wonder if that's why it's happening. So that's a completely wild effect I get from antidepressants that I've never heard of happening to anyone else. They become really vivid, stuff that it's not just like the flashback. I also get like the knowledge of what happened sometimes, just kind of unconnected to the flashback. It's interesting, but it's making me remember stuff. It nullifies, it like reduces my interest in sex and dating a significant amount. It doesn't totally erase it. I don't like that. It does help blunt the anxiety to some extent, but not really as much as I would like. That remains to be seen. We'll see if it helps. It helps a bit with my chronic pain. It helps with my fibromyalgia. So it helps with that a little bit. So all in all, they work better now for me as an adult than when I was a kid, and I just had severe depression. I first tried to kill myself when I was 7 years old. I made a couple of attempts as a kid, a couple of attempts as a teenager, a couple of attempts as an adult. I'm not very good at killing myself, fortunately, so usually I get intercepted in the middle of it, or I stupidly tell somebody. Water. I don't have any water in here right now. I will go get some in a bit. Actually, you know what? We'll do a water substitute. This is my Christmas cookie body spray. It's one of my favorite flavors. Oh, also, check out Nick's Galaxy. He's one of my favorite... I was moving the wrong hand because this is mirrored. He's one of my favorite streamers. He's really cool. He does video game streaming. He's like the sweetest guy. So if you want a streamer that's all good vibes and he's funny, go check him out. I just remembered I was wearing his shirt. He's a friend of mine too, so sometimes we play games together and stream together. But, so yeah, antidepressants now have an effect. Sometimes they trigger pain flashbacks. Like I had this really bad flashback where I guess I had been abducted. So my flashbacks don't have a lot of context. It's like, well, it dumps me 5 minutes here in the middle of a trauma and they're super painful. So I got stun gunned on the face after the people that abducted and assaulted me had knocked me out. They gave me something that made me really like compliant, almost like I don't know, maybe like heroin or something. I've never done heroin, so I have no idea. I don't know what any of these drugs would feel like, but it was really weird. And they stun gunned my forehead and it caused these like rainbow sparks, like a mask to appear. And I said something really stupid too. I was just like, oh my God, you'll never break me. I'm taking your pain and I'm making beautiful images of masks with it. And then they said that I was making a retard mask. I remember this super vividly because this is the shit I flash back to. So, but the pain was there. It was like, oh my God, excruciating pain. And this is what a full flashback that was triggered by taking Lexapro did to me a couple months ago. Oh my God, the pain was blinding. I could feel getting stun gunned on the head repeatedly. I vomited because the pain was so bad, like a bunch of times I had a puke bucket. I have not tried to play Pokemon Unite yet, but I will eventually. It's something I'm planning on doing. So yeah, Zoloft has really had an extra effect now that I have extra traumas to remember. So that brings me to mood stabilizers, which fucked me up really badly. The first time I took them for the seizure, I took oxcarbazepine, and to be honest with you, I didn't notice anything. Like, no side effects, no actual effects, it just didn't do anything. So, the second mood stabilizers I tried were Keppra and Lamictal. Lamictal didn't do anything either, but I was too scared to take it for more than a week, so maybe that's why it didn't do anything, and it might have if I had taken it for longer. Keppra made me go wild. So when somebody has PTSD, they have triggers, and so you never know what's going to trigger you. Like, I've been raped in a room with a blue light before, so somebody could literally just have a Reddit username that says blue light torture 6969, and I'll fucking freak out. Well, not anymore, but when I was on Keppra, I fucking freaked out because it would trigger the flashback, but because I was knocked out during part of the flashback or couldn't remember it at the time, it just, like, I mean, I remember some things about it, but it was like triggering something I couldn't remember that time. And I just went, wow, and I'm like, it's them. they're sadistically laughing at me on Reddit. You know, I stopped. So I'd have these partial flashbacks without having a memory, but it'd just be like whatever triggered me, I was confused and thought it was the person that had raped me. This happened over and over again. I got shadow banned from Reddit because I kept insulting people. That was basically psychosis. That's a post-traumatic psychosis. So I don't take mood stabilizers now because they just make me hyper reactive to all of my triggers, and then I think everyone is the people that rape me sadistically laughing at me. It's not. I'll stop flashing back 10 minutes later. I'm like, oh shit, I just yelled at some random guy on Reddit. No wonder why I'm shadow banned. One of the guys I yelled at on Reddit for like 2 years straight while I was on this crap, and this was in the immediate aftermath after a lot of bad stuff happened to me. His account got banned. I swear to God, he had perfectly fine content. And I swear, at the end of the day, I think my constant messages accusing him of being a pedophile and how, like, I fucking hate him and all these, like, I said a lot of really weird stuff to him. I'm convinced it got him banned from Reddit. Sorry, buddy. You had some pretty good and high quality posts, but you reminded me too much of this one girl that abused me in college. All right, so I'm not like that anymore, but while I was on those meds, I was just fucking crazy. And so there are different types of psychotic episodes, and that would be a medication-induced psychotic break that was exacerbated by my PTSD. So it's both types of psychoses. A lot of people don't know this, but a sufficiently extreme mental illness of any type, the anxiety disorders, depression, bipolar, all of them can cause psychosis. And they all look very different from each other, actually. So there's that. Let's see. Oh, technically, so I mentioned earlier. Actually, no, I don't think I mentioned that earlier. I mentioned that in something else I was recording. So yeah, so now we'll go on to antipsychotics. A lot of doctors have thought that I have bipolar, and I don't think that I do. I think that I might have had bipolar when I was younger, but after getting stun gunned on the head a bunch of times as an adult, I'm just kind of always minorly manic. I don't really cycle into depression. My life is just kind of agonizing sometimes for very reasonable reasons. But so I've a common treatment for bipolar is antipsychotic medication, believe it or not. That's also used for depression and severe anxiety. Like severe depression and severe anxiety gets treated with antipsychotics too. So as a kid, they didn't really do anything to me. As an adult, they are incredibly strong. Oh yeah, before I move on from antidepressants, they affect my DID a lot. It's not just my PTSD. They make communication more vivid between my alternate personalities and kind of more refined. But otherwise, so it's like we hear each other and sense each other more strongly than we normally do. But yeah, so antipsychotics are fascinating. They really fuck with my DID and my PTSD. Hey, Nick's Galaxy, welcome in. So here's what they do. They give me these hyper vivid flashbacks, sometimes up to 3 to 5 a day. It was so many. And because my flashbacks have this pain component of like getting stun gunned on various parts of my body, I vomit when I flash back to it. Oh, by the way, I got banned from TikTok because apparently being honest about what happened to me counted as like a realistic depiction of torture. And I'm like, oh my God, you're censoring a torture survivor. Way to go, TikTok. Fucking censorship, what the fuck? But YouTube does not see it that way. This is educational. So I was tortured on various parts of my body with electricity. Anyway, it was excruciatingly painful. So the antipsychotics caused me to re-experience flashbacks of things like I had, I'm going to put this as very triggering. I had I'm not sure what it was. It looked like a power drill or like a speculum that had like a cord coming out of it. Put that in my vagina. I had horrible vaginal injuries after that. So I flashed back to that and the pain on antipsychotics, and I'd been knocked out for it. I woke up with injuries and a dislocated shoulder, and my vagina was damaged for almost 2 weeks. It hurt to sit down. It hurt to wear underwear. It just hurt. I was crying. It was really damaged. I didn't go in for a rape kit though, because I had gone in for a rape kit during one of my past rapes and it didn't fucking matter. It didn't matter. The detective asked my mom questions and basically blurted out, well, she could have just bit herself and like rough sex. It's like, I wasn't sexually active at the time, you asshole. I was raped. Oh my fucking God. So, how badly my police investigations have gone over the years is a subject for another video, but they're very disappointing. The police are basically just regular people, which is frightening because regular people don't know how to solve crimes or understand the mind of a rapist. Well, but anyway, so the antipsychotics made me re-experience things like that, or the time I got stun gunned on the chest and my abuser said that they were going to come assault me like every night until I had a heart attack from all the electrical damage and died. They also stun gunned the back of my head, said the same thing. So I would remember all sorts of things like this hyper vividly. So a flashback is not like a repressed memory. It's not like getting a memory back. There's no such thing as a false flashback. Let me just put that out there. You know how you can say a memory could be false because you can't remember if you imagined it or if it was real, which is somewhat true. Apparently there's new research now, though, that shows that the brain does reality checks on your memories, though, in order to differentiate real from imagined scenarios. So actually it turned out that wasn't the case. A flashback is not a memory. A flashback is not your imagination. A flashback is not a nightmare. Okay? It is its own distinctive thing. And you can have it in bits and pieces, so it can be hard to tell that it's a flashback because you can have, like, the emotional sensation of what happened, the physical sensation of what happened. You can have those without actually having a memory go off in your head, but it is related to that, and it is a flashback. But, so these were triggering full on, like, oh my God, my memory was photographic. Like, I could see every wrinkle and every facial expression on my abusers' faces. Like, I could remember every single bit of dialogue that they said, word for word. And I felt the pain as they, like, you know, stun gun on my chest, felt the blinding level 10. The pain was so bad I was vomiting. Like, one of them was so bad, I remembered getting stun gunned on my chest and my genitals at the same time. It was like a man and a woman doing it. It was two different people. And I vomited on my bathroom floor because I'd been at the toilet because the flashback had been going on for a while and I'd been puking. And then I passed out from the pain. I passed out from the sheer pain. Like, I have been through some rough pains in my life. Like, I've had a kidney hemorrhage that the doctors diagnosed as a kidney stone, even though I don't think it was. And I've had another time where my kidneys were being crushed by my colon that required medical attention. I had labor contractions. Those very real pains are not as bad as the pain in my flashback. Let that sink in. And there's no other medical problem that's causing them but flashbacks. I had that medically investigated. So antipsychotics put me in this hellish reality where I was going through excruciating level 10 pain multiple times a day. Now, not all of them had excruciating pain. A lot of them would trigger a drug flashback because I got knocked out with what I guess was drugs. So I would also vomit and have vertigo from that. It would feel like I was on drugs. I was basically delirious during my flashbacks. So yeah, antipsychotics are potent. They made communication between my alters in my head more vivid, but they also drastically cut the noise, and I didn't have blending and co-consciousness as much anymore. A lot of times I would just end up as one and only one alter, and I had massive time loss problems on these things. It was terrible. I don't usually have really bad time loss. I usually remember the gist. I had horrible time loss on them. But so they gave me back repressed memories, both from childhood and adulthood. Antidepressants did that to some extent, but antipsychotics really unrepressed. I basically saw the impossible, the stuff that I had been wondering about for years, but it had been knocked out of me. So antipsychotics were interesting. I have a new psychiatrist, and I told her I don't want to do them, but I actually kind of do because I'm obsessed with remembering, even though it's extremely painful. And I say that now. Okay, every time I go on antipsychotics again and I have my first flashback, the very first thing out of my mouth was, I was so arrogant. This is so horrible. I can't live through this. I had a flashback of a guy stun gunning the back of my head, and then he got off on it because it caused me to have a seizure. You know what? I should just do a video of my horrible flashbacks. I wonder if YouTube will think it's too extreme of content, which is fucked up. Like, imagine being me. I had to go through this shit. I want people to know what happened to me. I want people to know I was alive and I fucking survived the unsurvivable. Also, I had injuries indicating five different assaults happened since I moved back home in 2019. But I think it happened more often than that. There just wasn't always a mark left over. But yeah, so that's my experience with medications. They're terrifying. I appreciate that, Nick's Galaxy. I'm going to do a more traditional stream in a second here. I'm thinking of just having, like, recording myself play MapleStory for a bit. I do that to unwind sometimes. It's such a crap game, but I don't know, it's relaxing, and they made leveling way easier than it used to be like 20 years ago when it first came out. But yeah, this has been an eclectic video by me. But before I forget the flashback, because sometimes I have a hard time remembering them. Actually, I forgot which flashback I was talking about. Never mind. But as for which alternate personality I am, and I like to sign off some of these videos, I'm just Ludi today. I'm 3 days into Lexapro now. It's already starting to cause nausea attacks that feel connected to a flashback. So I can get these nausea attacks, and I know it's connected to a flashback because it's suddenly like inside my head, I start hearing all the nasty things that my abusers said to me, or I start predicting what they would have said to me. Like they're this presence still in my life just over my shoulder. And then I know that it's related to the flashback because I've had these blow into actual flashbacks. So, yep, I hope somebody found this content interesting. I'm going to upload this one to YouTube. I made a second YouTube just for mental health content because I know it's super triggering and not for everyone. So we'll see how this goes. Oh, by the way, Nick's Galaxy, I'm wearing your shirt for this stream. I don't know if you can see because you said you're just listening, but I got it on. I put it on this morning because I'm wearing pants that are the same color as it. Alright, I'm going to stop the stream for now, but I'll come back on in a little bit with a game. Take care.